that all specialties can and should add this treatment to their daily clinical practice. What do you mean, Andrea? I showed you that bruxism is not TMD, right? Right? And now I'm showing you that there is a cracked tooth syndrome. There is a syndrome of fractures and cracks. Look how interesting. This was published in the New York Times in 2019, and it was widely discussed during the pandemic period regarding the impact of COVID, the impact of the pandemic, and the increase in bruxism worldwide. What does this have to do with different specialties? If you are an implant specialist, for example, this study here is from before the pandemic. This one is from 2018, before the pandemic. Do you know what it was already showing? The conclusion of this study discusses the analysis of implant fractures, a retrospective study, a clinical study. And the conclusion of this study is that occlusal overload caused by bruxism or inappropriate occlusion in implant-supported prostheses, or the combination of both factors. Do you know what that means? That in the first year after you load the implant is when it is at the highest risk of suffering a fracture or having a problem. Occlusal overload caused by bruxism, it's in the study, and inappropriate occlusion. Both are problems that will cause implant failure. There's no denying that bruxism is directly related to implant failure. We know this. With overload, with excessive occlusal force, which causes fractures, which causes screws to loosen, which causes the patient to keep coming back with the prosthesis, with mobility, thinking they've lost the implant. And that's why you, as an implantologist, if you want to stand out, if you want to stop having problems with your patients, you need to offer a differential diagnosis of bruxism associated with your implant treatments. Already during your patient's appointments, in the first consultations, and in follow-up visits. And a real treatment for bruxism alongside your implant treatment, not just a mouth guard. After all, in order for you to make a final mouth guard for your patient, they already need to be in the ceramic phase.